Have 1 o'clock on the call. Good afternoon, everyone, and thank you for joining the Health Department's weekly Friday briefing with Dr. Farley. Today, we'll be joined by Philadelphia Corporation for Aging CEO, Mr. Naja Orr. Both he and Dr. Farley will be talking about COVID-19 vaccine distribution and the ways that the city is making it available. Following their prepared remarks, we will provide those remarks in Spanish. Then we'll open the floor to questions from the press. Today, we will be ending at 1:30. Now let's get started. Dr. Farley, you have the floor.
Thank you very much, Jim. Let me talk about where we are with vaccination. First, as you know, now everyone in Philadelphia over the age of 16 is eligible for vaccination because we want to get younger people vaccinated, but we also want to get older people vaccinated. We're calling this week Bring Your Loved Ones to Get Vaccinated Week, which we're encouraging young people to bring their older parents and grandparents and relatives to vaccination sites and get vaccinated together. How are we doing vaccine administration overall for the week that ended April 18th? So far, we have 99,000 doses administered by all providers across the entire city. I expect that number to increase a little. That number is lower than the 120,000 doses administered the week before that. And it's a sign that demand for vaccination is definitely slowing. And it does mean that there are available slots at most of our vaccination clinics. But I do want to remind people that 100,000 doses delivered a week in a city of 1.2 million adults is still very many doses delivered, very many people vaccinated. Now, as of Thursday, a total of 708,000 people were vaccinated by Philadelphia providers, having received their at least one dose of vaccine, and 465,000 people were fully vaccinated. Now, if you want to know how well we're covering the population of Philadelphia residents, the best data source for that is the Centers for Disease Control, because they have information about Philadelphia residents who are vaccinated outside of the city. By their numbers, 32% of people over the age of 18 are now fully vaccinated, and 53% of people over the age of 65 are now fully vaccinated. Now, it's clear from the numbers we're seeing here that we are entering a new phase in which we have more supply of vaccine and more supply of vaccination slots than we have demand. Now, as with phase one, this new phase, phase two, will last months. And during that time, it's our job to make it as easy as possible for people to get vaccinated and to encourage people to be vaccinated as much as possible. I'm going to talk a little bit about some of the larger vaccination sites that we're operating. The Center City Vaccination Center at the Convention Center is, as you know, now delivering Pfizer vaccine. They're using the first doses. They vaccinated about 2,600 people on Wednesday, about 800 people on Thursday. That site is available for walk-in, and their appointments also available. Then the federally supported type 2 vaccination site at Esperanza at Hunting Park is now open 5 days a week, Monday through Wednesday and Saturday and Sunday. They vaccinated about 470 people on Wednesday, despite having a couple of interruptions because of severe weather. That also is available by walk-in as well as by appointments. Then we're operating a series of neighborhood clinics that we talked about before. Now, these neighborhood clinics is different. The volume there, the number of people coming in there, has stayed relatively high. They're doing about 400 to 500 people per day. So this is a sign that the people who are not vaccinated yet are more interested in getting vaccinated closer to home. Now, there's a calendar posted on our blog, on our website, about all of our neighborhood clinics so people can see where they can get vaccinated in the future. And now people can schedule themselves for an appointment at any of these clinics. So go to www.phila.gov/COVID, get your link right into the scheduling software for any of our neighborhood clinics, as well as the Convention Center, as well as the Esperanza Center. Now, in addition to that, we're now up to about almost 250 providers in the city that have vaccine to deliver to people. That includes hospitals and clinics, an increasing number of pharmacies, and an increasing number of outpatient medical practices. And increasingly, those providers are allowing walk-in service. I want to talk just a little bit about our outreach. We are doing outreach in a variety of different ways, including phone calling to our vaccine interest database, those people who have registered their interest in getting vaccinations in the past. We're doing phone banking in the low vaccinated zip codes. We're doing, there's phone calling taking place by health plans, as well as by other organizations like the Philadelphia Corporation for the Aging that you hear more about in just a minute. And we're doing some canvassing in the low vaccinated neighborhoods around vaccination sites. Now, let me just talk a little bit about restrictions we have, our social distancing restrictions before I finish. We still, as you know, are experiencing very high case counts, more than 500 per day. But we have been having ongoing conversations with an advisory group of restaurants about the restrictions. And we're trying to help businesses adjust and make money without having to risk an additional spread of the virus. So we have agreed this morning to 2 adjustments to restrictions for restaurants that may help them. First is that restaurants that have outdoor dining can have their outdoor dining capacity above 50 people. Have to submit a plan to the health department, but they can do that. There's no limit at 50 people. Second is restaurants that have a bar will be able to seat groups at the bar of up to 4 people from the same household. They need to be more than 6 feet of distance from other people at the bar and other tables. And there needs to be a barrier in front of them so that there's a separation between them and any person tending the bar. So these are small adjustments that we hope are useful to the restaurants. And we'll discuss more our restrictions on restaurants and other sites at a press conference this coming Tuesday. That's the update for today. More information on all of this is at www.phila.gov/COVID. Now I'll turn it back to Jim.
Thank you very much, Dr. Farley. Mr. Orr, if you would like to unmute yourself and bring your camera back on, you will have the floor.
Thank you, Jim, and thank you, Dr. Farley. Good afternoon. Once again, my name is Nadja Orr, and I'm the President and CEO of the Philadelphia Corporation for Aging, the Area Agency on Aging for Philadelphia County. To give you a little background about PCA and the AAA network, it really starts with the Older Americans Act of 1965, which was the federal legislation that was not only the framework for services and supports to support older adults in the community, but also it eventually led to there being federal, state, and local offices, the local offices being the area agencies on aging to support older adults. PCA is one of 52 area agencies on aging in the state of Pennsylvania, and there's more than 600 across the nation. I will say that Pennsylvania is unique though, because we do have the lottery that does support older adults. In addition to the services from our offices across the Commonwealth, the Pennsylvania Lottery also supports written property tax rebates for older adults, transportation services through the shared ride program, and the state's PACE program, which is the Pennsylvania's drug program, prescription drug program for older adults. PCA started supporting older adults in 1973, and since then we've grown to more than 30 programs that support more than 140,000 of our older adults in the city annually. We typically, like most area agencies on aging offices, follow 3 different paths. That first path is assisting older adults with staying connected to the community. That would be programs like senior employment programs, senior centers, health and wellness programs, volunteer opportunities, things like that. Then there's the middle path, and that's supporting older adults that need additional assistance to stay safe in their homes. That's where our care managers and service coordinators go into the homes, typically complete comprehensive care plans and develop care plans to really meet the holistic needs of that consumer, pairing them with things like home care, adult daycare services, home modifications, or medical equipment and supplies. And then there's that last path, which is advocacy and protection. And that would be supports like legal counseling, the ombudsman program for people who have concerns or complaints who are receiving long-term care services. And then, of course, our older adult protective services unit, who they are responsible for investigating elder abuse to ensure people live free from abuse, neglect, financial exploitation, and abandonment. We are designated as one of those agencies that provides emergency services throughout the pandemic. That would be supports such as our assessment and care planning functions, as I mentioned, our nutrition programs, whether it's the home delivered meals program or traditional congregate meal program out of the senior centers, has transitioned to grab and goes. As most of the centers are still closed at this time for programming, they've transitioned to virtual programming, and their congregate meal program has transitioned to grab and goes, so people can arrive at the center and pick up meals, several days worth of meals. Other areas where we've been designated as examples of as emergency services that we provide, the virtual programming to combat social isolation that I mentioned at the senior centers, and then of course our advocacy and protection services. A number of focus areas as it relates to older adults and vaccinations, and our efforts in supporting Dr. Farley's efforts include education is the first path I'll mention. which we want to ensure that our staff and the community are educated in the latest and greatest information that comes out from the health department and CDC. And that includes instances where we've had information in our publications throughout the agency, our agency publications, and we've held not only internal town halls, but a community town hall back in March, and we're planning additional community town halls to ensure older adults and the community is educated and doing our part to ensure people understand the latest and greatest information. Next I'll mention is assisting with getting people registered for the vaccine. That's where our care managers and other staff members are working directly with the consumers that they serve to ensure that they are registered for the vaccine. We know that the vaccine is a large step in us combating the pandemic, so we want to make sure we're doing our part with getting our consumers registered. Next thing I'll mention is assistance and partnership with our state office, which is the Pennsylvania Department of Aging, the PACE program, as I mentioned a little earlier. They are now providing assistance for individuals that are age 60 and over to call and to get registered for the vaccine. They've offered a separate call line, a separate 800 number. That number is 800-424-4351. I'll say that again. That number is 800-424-4351. And that would be a separate dedicated line that would support the city's 311 efforts, specifically addressing those people that have concerns or want to get registered for the vaccine that are 60 and over. And then the last effort that I'll mention at this time would be supporting our homebound consumers, those consumers that we serve that we know are homebound. And that's where we are partnering with the health department and the fire department to ensure that we go into the homes for those older adults and ensure that they're receiving the vaccine. For those people who can't get to a vaccination site, that's where we're working and partnering with the health department and the fire department to ensure those individuals are vaccinated. We, throughout this time, want to ensure people know we at PCA are here as a resource for them. So whether it's a friend, a neighbor, family member, another loved one who's 60 over, any questions or concerns regarding supports and services that could be provided to them, do not hesitate to contact our helpline. Our helpline number is 215-765-9040. Thank you.
Thank you very much, Mr. Orr. Now I'll turn it over to Ms. Ellie Colon, who will present the remarks in Spanish.
Buenas tardes. El resumen de Dr. Farley sobre la vacunación. Ahora todas las personas mayores de 16 años son elegibles para recibir la vacuna. El mensaje de esta semana fue: traigan a sus seres queridos para vacunarse. Queremos alentar a los jóvenes a llevar a los padres mayores, abuelos y sus familiares a los sitios de vacunación. La siguiente es la administración general de la vacuna. Para la semana que terminó el 18 de abril, hemos administrado 99,000 dosis hasta el momento y esperamos aumentar un poco más una vez que todos los informes han sido calculados. Esto es menos de las 120,000 vacunas que se administraron la semana anterior. La demanda se está descarrilando. Tenemos citas disponibles en la mayoría de las clínicas de vacunación, pero vacunar a 100,000 personas durante solo una semana en una ciudad de 1 millones de adultos todavía es impresionante. Desde ayer hemos administrado 708,000 primeras dosis y hemos vacunado completamente a 465,000 personas. El 32% de las personas mayores de 18 de edad y el 53% de las personas mayores de 65 años están totalmente vacunadas, según datos de la CDC. Estamos entrando en una nueva fase. Hay más oferta que demanda. Está claro que la fase 2 durará por meses. Nuestro trabajo es hacer que sea lo más fácil posible para que las personas se vacunen. El centro de vacunación de la ciudad en el centro de convenciones está utilizando Pfizer y administrando las primeras dosis. 2,600 personas fueron vacunadas el miércoles y 800 personas el jueves. Oportunidades de walk-in están disponibles y también citas. El sitio de vacunación tipo 2, apoyado por el gobierno federal en Esperanza en Hunting Park, ahora está abierto 5 días a la semana, de lunes a miércoles y los sábados y domingos. Este sitio vacunó a 470 personas ayer y el miércoles, a pesar de interrupciones por el clima del día, y está disponible para walk-ins y citas. Con respecto a las clínicas del barrio, el volumen sigue siendo alto. Estamos vacunando entre 400 y 500 personas por día. Esto es una señal de que las personas están más interesadas en vacunarse cerca de casa. El calendario para estas clínicas ha sido publicado en blog en nuestro sitio de web. Puedes hacer una cita en el sitio de web at www.phila.gov/COVID. A partir de ahora tenemos 247 proveedores totales. Estos incluyen hospitales, clínicas, farmacias y consultorios ambulatorios. Cada día permiten más el walk-in. Con respecto a la divulgación, estamos haciendo llamadas telefónicas a la base de datos Vaccine Interest, banca telefónica en códigos postales de baja vacunación, llamadas telefónicas por planes de salud y otros, incluyendo la Cooperación de Filadelfia para el Envejecimiento. Y también estamos regando información en los barrios. Sobre las restricciones, todavía tenemos recuentos de casos muy altos, 500 casos por día, pero estamos en conversaciones con restaurantes sobre restricciones para tratar de ayudar a las empresas con el riesgo de propagación. Acordamos 2 ajustes a las restricciones que pueden ayudarlos. La capacidad de comer al aire libre puede estar por encima de 50 personas. Pueden sentarse grupos de hasta 4 personas de la misma familia en las barras, manteniendo 6 pies de distancia de los demás y barreras enfrentes. La semana que viene, en el martes, discutiremos más restricciones. Ahora, el mensaje de Nadja Orr. La Corporación de Filadelfia para Envejecimiento, PCA, fue creada hace 50 años como resultado de ley que asigna fondos a servicios vitales basados en el hogar y a la comunidad para adultos mayores. PCA ofrece programas en diferentes áreas, incluyendo comunidad y conexión, ayuda en el hogar, protección y promoción y apoyo al cuidador. PCA financia 28 centros para personas de tercera edad y sitios de comidas en Filadelfia. Durante los últimos 13 meses, PCA ha trabajado para responder a las necesidades agravantes de filadelfianos mayores como resultado de la pandemia, incluyendo abordar los problemas de inseguridad alimentaria a través de programas de comida caseras y grab and go, y abordar el aislamiento social a través de la programación virtual, tanto a nivel de centros de mayores como a través de nuestros programas de promoción de salud, ya que muchos continúan quedándose en casa durante este tiempo. Siendo una voz de confianza para la comunidad envejecida en Filadelfia, PCA ha sido capaz de colaborar con éxito con la ciudad de Filadelfia y organizaciones comunitarias para ayudar a los esfuerzos de vacunación de la ciudad para los filadelfianos mayores. Sabemos que una gran parte de eso es el intercambio de información y recursos, lo que seguimos haciendo en nuestro sitio web pcacares.org y a través de nuestros diversos canales de comunicación a adultos mayores y partes interesadas profesionales. PCA ha estado trabajando con el Departamento de Bomberos de Filadelfia para vacunar a sus consumidores elegibles de PCA que necesitan ser vacunados en casa. Desde que empezó colaborando con el Cuerpo de Bomberos, PCA ha sido capaz de identificar y suministrar más de 300 nombres consumidores de PCA que están en casa y que desean ser vacunados, por lo que el Departamento de Bomberos es capaz de llamar y programar directamente un tiempo para venir a la casa del individuo y administrar la vacuna. Además, estamos trabajando con el Departamento Municipal de Salud Pública y utilizando enlaces de programación de vacunas para programar los consumidores de PCA que necesiten asistencia para obtener citas. Estamos colaborando con el programa de asistencia médica PACE de Pennsylvania en una nueva línea directa que permitirá a los filadelfianos mayores de 60 años llamar y programar directamente citas de vacunación en sitios de vacunación por teléfono. Estamos muy emocionados de compartir que la línea directa se lanzó oficialmente hoy, viernes 23 de abril, y está disponible para todos los filadelfianos mayores de 60 años llamando al 1-800-424-4351. Ahora me gustaría darle las gracias al Dr. Farley por invitarme a hablar aquí hoy. Apreciamos todo lo que la ciudad está haciendo para vacunar a los filadelfianos mayores y por la capacidad de colaborar con la ciudad para asesorar en estos esfuerzos. También quiero darle las gracias al Departamento de Bomberos de Filadelfia y a PACE por liderar estas iniciativas. Como siempre, la línea de ayuda de PCA está disponible para todos los filadelfianos mayores y adultos con discapacidades necesitan recursos. Ese número es el 215-765-9040. También quiero aplaudir a todos los filadelfianos mayores por su resiliencia y fuerza durante este tiempo sin precedentes. Aunque esta pandemia ha cambiado la vida tal como la conocemos, juntos la podemos superar. Muchas gracias.
Thank you very much, Sally. Next, we'll move to Q&A. Reporters are asked to limit their questions to 2 or fewer. Please try to keep the questions focused on today's topic at hand, which includes the work that PCA has been doing around COVID vaccinations. If there are any reporters who do not get an opportunity to ask questions before 1:30, please follow up by email and we will work to get you an answer. First up, we will go to Laura McChrystal of the Inquirer. Laura, you should be able to unmute now.
Hi, Dr. Farley, I have a question about racial equity in vaccinations. Generally, I'd like to ask, how do you think the city is doing? Are things improving there? And second, I guess more specifically, how is it tied to appointments becoming more open? Like, for example, at the beginning, we are seeing, some pharmacies in North Philly were actually vaccinating a lot of white residents, and they might not have even been living in the city. So are those appointments, can you speak to whether those appointments are now going to residents matching more the area they're trying to vaccinate, or are those appointments going unfilled now?
Yeah, thanks for the question. So I'm not happy with the gap that we are seeing in the uptake of vaccine by race. Big difference among whites and African Americans are the group that's got the lowest vaccination rates. If you look at our website, you'll see that is predominantly among younger adults. If you get to people age 65 and up, it pretty well matches by race. And it does seem to be that the requirement to schedule an appointment, often online, has made it more difficult for African Americans to get in. And as we get to more walk-in appointments, I think that I hope anyway, that we'll see more African Americans representing a larger percentage of those folks getting vaccinated. We have seen that at the convention center. As the total number of people vaccinated there has gone down, the percentage of those who are African American is actually going up. And we earlier when we went to walk-ins, we saw the percentage of African Americans going up. We're doing everything we can to make vaccines available in the low vaccinated zip codes that are often predominantly African American zip codes on a walk-in basis. And I'm hopeful that when we do that, we will see an increasing fraction of those folks be African American.
Okay. And can you speak at all, with the numbers you gave were represented kind of a steep drop off at the convention center. Are all providers seeing that level of drop off, and how many doses are going unused at this point?
So that drop off appears to be sharper at these very large mass vaccination sites, with the convention center showing the sharpest drop off. As I said, in our neighborhood clinics, we're seeing only a slight softening of demand. So, again, 400 to 500 per day, that's about what we were doing in our neighborhood clinics 2-3 weeks ago. We're still doing that. So to me, that's a lesson that putting vaccination closer to people's homes is the way to get people who are still unvaccinated to be vaccinated. And I think it's because those people are not opposed to vaccination, but they've just got many other things going on in their lives. And so it needs to be convenient for them.
Okay, thank you.
Thank you very much, Laura. Next, we'll move to Alicia Reed from CBS 3. Alicia should be able to unmute now.
Thank you so much. Dr. Farley, looking at the fact that there's more vaccine supply than demand right now, and looking forward to next week, do you think there will be more additional restrictions that are lifted? For example, if the number of vaccinations increase, if people start flooding into these sites and the number of vaccinations increase, when do you think, or do you think it will happen sooner than later, that larger venues will be able to increase capacity?
Well, our decisions about restrictions are going to be based more on what's happening to the epidemic than what's happening to the vaccination rates. Ultimately, vaccination rates should have an impact on the epidemic, but the best way to see whether it is to track the case rates. Case rates last week were slightly higher than they were the week before. This week, there's signs it may be actually decreasing a little bit. We hope so. And so we'll watch that closely. And as I said, we will have more information to provide to you at our Tuesday press conference about the future of restrictions.
Alicia, any other questions?
And nope, that was it. Thank you so much.
Thank you very much. Next, we'll go to Kennedy Rose from the Philadelphia Business Journal. Kennedy, go ahead.
Hi, everybody. Dr. Farley, thanks for taking the time. One super quick clarifying question. Is the bar seating allowance as of today?
Yes, we said they can do that immediately.
Okay, great.
We're just communicating that, there was a meeting this morning where we made that decision, and I was asked to go ahead and communicate that at the press conference today, and we're going to get that out the word as quickly as possible now, and I hope you can help us with that.
Okay, and I was wondering, why allow bar seating? Is there just about as much of a chance of transmission there as there is with regular indoor dining seating?
So is the question, why do we allow it, or why do we not allow it before? We're allowing it now because there are restrictions we think we can have on bar seating that will make it no riskier than table seating. But it initially was restricted at the state level as part of the overall restrictions on bars. And we do think that bars are riskier than restaurants. When people are drinking and not eating, then they're more likely to be risking other behaviors.
Wonderful. Anything else, Kennedy?
Sorry, I muted myself there. That's it for me. Thanks so much.
Thank you very much. Next up, we're going to go to Nina Feldman from WHYY. Nina, you're on.
Hey there. Thanks for taking my question. First question, Dr. Farley, in the new graphics on the website that show the breakdown by age and race, it really looks like the racial disparity there is driven primarily by that younger group. Like, the rates are really similar for all the other age groups, at least between white residents and Black and Latino residents. I guess I just wanted to get, your response to that. Is that because white and Asian residents were getting vaccinated before they were eligible at a greater rate than Black and Latino residents? It just seems like it affects how the city would respond, knowing that information, that it's primarily driven by that group. So I'm just curious to see how you all are kind of interpreting that and responding to it.
I can't say, with too much certainty as to why there is such a big disparity among young African Americans in particular. There is, been looking earlier today at survey data on vaccine hesitancy. Vaccine hesitancy is greater among younger people and it's somewhat greater among African Americans. And so if you have younger African Americans, that's a group that in general is more hesitant. But it may also get back to convenience issues. We've tried to make vaccine as convenient as possible, but maybe it's, for some reason it's been more inconvenient, or the nature of the lives and work of young African Americans makes it tougher for them to find the time to be vaccinated. I don't know. I'm pleased that we don't see racial disparity amongst the age group that is most likely to have severe illness. But I still think this is a problem. And clearly the center of our target for the future is going to be younger African Americans.
And it's just a follow up to the kind of the questions of access that are driving some of the disparity that you mentioned. Why didn't the city kind of enact some of those solutions or strategies from the very beginning? The walk-ups, the sort of increased access for transportation, things like that could have been anticipated, since these are the same vulnerable groups that made it hard for them to get COVID tests, for instance. Why not have those kind of tools in place from the jump?
First, that vast majority of vaccines are not administered by the city. They're administered by other providers, hospitals, clinics, pharmacies. And at all those sites, up until just about 10 days ago, there was a much bigger demand than there was supply. And so they had to figure out how to sift through and have the only people who are eligible. And so that meant you had to have some sort of communication with people in advance before they had an appointment, which made it be very, very difficult, if not impossible, to have walk-in service available. But we did encourage all of those providers at every step along the way to do everything they could to reach out to African-American populations. So there was much work done, for example, with services being provided at churches by hospitals, for example. Not enough, but that much work was done. And when the demand started to get lower, to get closer to supply, then we've been pushing and will continue to push for more walk-in access.
Nina, thank you very much.
Can I just ask one really quick follow-up question to Laura's question? Sorry. Tiny, quick thing. When you mentioned the neighborhood clinics that have stayed relatively level, as it's dropped off some at the larger mass clinics, do you mean the neighborhood PDPH clinics?
Yeah, the neighborhood clinics run by the health department.
Okay, thank you.
I mean, I should say, I think hospitals and others are running some clinics in neighborhoods as well. And what I'm hearing from them is likewise, that they're seeing some lessening of demand, but it's not nearly as much of the decrease in demand as we're seeing, say, at the convention center.
Thank you very much, Dr. Farley and Nina. Finally, we'll go to David Melandra, Philly Sports News. Philly, or David, go ahead.
Okay, I got a couple follow-up ones for Dr. Farley. First off, you mentioned about the supply of there's a lot more supply for vaccines. Any consideration of doing a potential mass vaccination at Lincoln Financial Field, as there have been talks about that?
At this point, that doesn't seem to make sense because of the pattern I've just been discussing, that you see our very large mass vaccination site here is seeing a big drop-off. The people we need to reach now are people who have difficulty getting out of their neighborhoods for vaccination. And so, a very large mass vaccination site doesn't make sense. A more distributed, large number of smaller clinics is what makes a lot more sense now.
Okay, and what do you say to those stadiums that want to host big concerts, have 100% capacity for summertime, like say Wells Fargo Center and other venues are considering hosting large concerts?
All I can say is that I don't think it's safe right now. We still have very large number of people being infected right now. Our hospitals are still very busy treating people, and there's some of them are having some signs of stress with the number of people being treated. So we're not there now. As to whether we will be there in the summer or the fall, I simply can't say. I wish I could predict this epidemic, but it's very hard to predict.
All right, thank you.
Wonderful. Thank you very much, David. As we've run over a couple minutes over time, that'll conclude today's press conference. I do want to mention to everybody, though, that this will be our last Friday briefing on this topic, unless there's a need for a briefing on a specific issue, and we will send out a media advisory in those cases. Thank you very much for joining us today and during previous Fridays with Dr. Farley, and we look forward to seeing you all again on Tuesday for the city's regular weekly briefing. Thank you all very much and have a good weekend.